And so I'm going to start off by sharing a lot of barriers and challenges that many families are either thinking about and wondering about before the conversation has happened within the home, or maybe they've shared and continue to have different thoughts and feelings around this. So often adults are grieving themselves when they're preparing or within these conversations. And they might be feeling quite overwhelmed or helpless in how to best support their children. When a parent hears that they have cancer, their minds immediately go to their children and how it's going to impact them. And as a parent, what I hear a lot and see a lot is that your instincts are to protect children. And really, we want to prepare children. And children can feel worries and sadness. And this concern is often greater when there's children that struggle with anxiety. And families want to avoid any kind of suffering that sharing of information might have on them. But we know that research shows that the less information we give, the higher anxiety children can experience. And we don't want them to worry, and we want to protect them so we don't talk about it. But in reality, children learn about cancer quite young. A good example we often hear and see and know that when children go to school as young as preschool and kindergarten, they're hearing and seeing things about Terry Fox. And they're hearing the word cancer. And their association to that is that it's life-threatening because Terry Fox did die. And so it's important to talk about it and call it what it is. And you might not know the right thing to say and not have the answer, but really giving space for those conversations is helpful in continuing those conversations. And you might have uncertainty and not know the right thing to say. Parents often wonder if they're saying too much, too little, how to provide the right answer. And this can be hard information and it can be emotional, but you don't have to fix things. And that's the important part to remember when you're having these conversations, is that you can allow for the space of the feelings and the emotions and just give room for it. And that you can have an ability to create an environment for children and families where you're letting them know and reassuring them that all reactions and feelings are healthy. And we want to teach kids normal human responses and give them tools to best support these feelings. Another barrier and challenge that can come up in conversations is that they're too young or they don't understand, but it's never too early to talk about cancer and to use the word. We do the next slide. Thanks. So there's many myths and misconceptions that parents and caregivers can often wonder about and experience within the home. And one of them is that we should avoid the word cancer. And we often relate to calling it a sickness and that mom or dad is not feeling well instead of naming it what it is. But it's really important to call it what it is. And the younger, the better. The more concrete we can make this for kids, the less abstract their thinking will be. And that kids aren't socialized to fear the word cancer. And by using the word cancer, it can really reassure them and it can be less scary for them. For example, a reason why it's important to name it what it is you say, daddy's sick, or, well, daddy has an illness, but what does that mean for a child? At school, they tell me, cover my cough because I'm going to make people sick, or COVID's going on right now. That's a sickness that's making other people sick. It's different. And it's important to be able to identify this so children's thinking doesn't develop into misconceptions. If a child doesn't talk, then we shouldn't talk is another misconception. But research shows if kids feel adults aren't comfortable talking, then they're not going to talk themselves. Kids won't bring up the topic in wanting to protect their families if it's not initiated. And as much as you're trying to protect them, don't leave it up to them to initiate the conversation. And it's giving that space again, that environment, that you're open to conversations, you're open to experiencing the really most difficult feelings you're ever experienced before together as a family, and being open about that. And adults need to start the conversation and often open the door for this. And it's okay if you say the wrong thing. I often refer to Andrea Warnick. She's a colleague here in Toronto, and she always says that parents wonder this, and they often have to say the wrong thing a lot of times to really confuse a child. And it's okay to have to try again. Maybe you didn't get it right the first time, but to go back and reassure them that you have the information, and that maybe the first time I didn't give you enough and I have some more information, and would you like to talk about it? And just really creating that environment. The idea to protect kids, it's important to reframe it in the sense that it's parents' job to prepare kids and not to protect them. And that the best protection is by preparing them. Because in life, by nature, really difficult things happen, and we all experience difficult things at one point in our life, but we need to learn to prepare children for these hard things and give them the tools to build resiliency towards the grief and suffering that they will evidently experience in their life. Another misconception is if I tell them, they're going to dwell on it. Well, we know that kids puddle jump through their emotions, unlike adults. And most kids don't think about things constantly and for a long time, and that their grief really changes over time. And they grieve in bits and pieces. You might have given them the most devastating news they've ever heard, and they're going to feel that. But they have this ability to come out of their grief and go back into it. And they could be crying one minute and playing around the next. And it's really amazing to see kids' ability to hold space for the feelings in their life and experience great joy as well at the same time. And many adults can't do this. And there's other reasons why adults can't do this, but it's just nice to see that ability in children. Sorry, Jocelyn, I'm going to hand it over to her for the next few slides.
All right, so for the next couple of slides, I'm assuming you can hear me okay?
Yes.
So for the next couple of slides, I'm going to be talking about some of the developmental stages and kind of overviewing the general understanding of cancer and grief that children can experience, but also kind of sharing some helpful interventions and some different strategies that you can use to support children in this area. So there's going to be a lot of overlap too among some of these things, but there are some key developmental markers as we get towards a different stage. So when we think about our infants and toddlers, young children, children at this age are learning about the world and their relationships through their senses. And it's very common for a caregiver to be very active in their life and, nurturing them and tending to their daily needs through that caregiving. But when a parent or someone close to them has cancer, there can be disruption in that routine. And sometimes, that is what a child notices because they're not able to have the capacity to understand what cancer is, but they notice those things. They might notice, a change in appearance or the change in somebody's smell. They might notice they're going to notice the person's absence. So if they're not able to be actively engaged in some of those routines. So when we talk about supporting this population, it's definitely important to make sure to find ways to supplement that. And sometimes we especially notice for parents who might be going through treatment and have some physical limitations, the way to engage them in nurturing touch. So for example, infant massage is a common intervention that I would recommend that parents can use with their infant to promote that bonding. Say, if breastfeeding isn't something that's possible due to, surgeries or other physical challenges that way as well. And there can also be those difficulties with separation, with a caregiver as well. So just finding ways that they can, have some consistency in their routine and finding other ways for a caregiver to be actively a part of their life if some of those things do change. And then when we start to look into toddlerhood and to our preschoolers, we definitely start to notice that magical thinking. And, as Tory had kind of previously mentioned, that the understanding does start to grow. So, it's common for parents and other adults to want to use the word sick. But it's important that this is the age where that magical thinking does begin. So children start to believe that things like cancer can be contagious because they're starting to hear that word sick in other contexts as well. We also see at this age group, sometimes children start to identify with different magical causes. So thinking that maybe mommy's in the hospital because I hurt my brother or something that I did. So they can start to develop some of this thinking as well. So it's really important to use that concrete and clear terminology with kids. And, it's something that it's an understanding that you have to nurture. It's not a one-time event like Tory mentioned, it's something that you scaffold. And oftentimes you might start to notice that these themes start to emerge in a child's play, and you can start to make those connections. Explaining body parts and, how people feel and be able to identify those things with children. And you might also notice that kids this age are starting to repeatedly ask questions commonly, even normatively in development at this age, children are at that why phase. Well, why? Or, where are you going? And even if you've shared that information before, that's a part of a child's ability to start to process that. So those are some key indicators of those age groups. And also too, engaging with your child in play at any point can be a really helpful way for you to start to understand what your child understands, because you're going to start to observe these themes in your child's play, and their understanding might start to really be shown through that as well. So that's your opportunity to provide that education. Maybe you're playing with some dolls and explaining what's maybe some changes that have happened in your body and finding some ways to incorporate that as well. And then we start to think of our school age children. And at this age, there's a couple of things that we need to consider. And I think Tory brought up a great point that I would highlight for this age group is this is the age where they're really starting, that understanding is really going to flourish and grow a lot more. But recognizing where a child's at and starting to see what has their experience with cancer been so far. So like Tory said, for some children, they have had that experience where they've heard about Terry Fox at school, and they now have this understanding that Terry Fox is somebody who has had cancer and he has died. But that understanding can be different from everybody. There's some families where they've had an example of somebody who has continued to live and thrive with cancer or beyond cancer treatment. So it's important to know that that's a very individualized situation that we have to consider. But a great way to start is to see what are the examples that this child has, and to be able to provide that reassurance that everybody's cancer experience is very different. There are some people who do die from cancer, but there's also many people who live and do very well. So it's important to kind of make sure that they understand both spectrums of that, especially because at school, when friends are starting to become a more prominent part in their life, they're going to be hearing conversations. And this is where little tidbits of information get transferred from child to child based on what the conversation is at their house and maybe the things that they know and understand. So we also talk about reassuring the 4 C's, and I'm not going to go into too much detail about this because Tory's going to talk about it a little bit later in our slideshow. But when we talk about the 4 C's, these are general things we talk about when having the conversation. So we will talk more about that. Again, the concrete thinking. So when we're talking about cancer, Tory will also get into some more detail about this as well. But, we're starting to talk about, I often use like the organs in your body. You know how you have a brain and you have a tummy and they all have important jobs. And then we say that, these parts in your body are made up of different cells that help you do those jobs. Well, cancer cells start to develop and those cells are different and they don't do their job. So using really clear and simple explanations like that is really helpful in shifting that understanding. Play is also a huge tool. So in the picture on the screen, you'll notice that there's a little Playmobil set up there, and that's a great way to help foster understanding for children. Again, similarly to younger children, they'll start to express their understanding or their questions, and that's a great opportunity for you to engage in, or even just to make those observations to see where your child is at. At this age, they also start to understand a few more concepts as it relates to death. And the reason why we also talk about this too is because that can often be a very common point in conversation because they've heard of people who die from cancer. And kids can often, it can be kind of striking when the first thing you do is talk to your child about cancer and maybe they say, well, are you going to die? And it's important to remember that there's lots of different aspects to death that children, their understanding emerges at different ages. So around this age, they start to understand that everybody will eventually die, and that when somebody dies, that it's permanent. And I also say this is important to discuss with children and to differentiate because they're noticing those changes, like when somebody's going through treatment, if they're really fatigued or, have low energy and they notice their loved one sleeping on the couch. I've had parents share with me that their child is worried that they're going to die, or, they look like they might be dead because of those major changes that they've noticed. So that's definitely something to consider as well. And also feeling of guilt is a big one. So, it's still part of that magical thinking is, feeling that responsibility. Did I do something or did I not do something? And I know I have a couple of families that I work with now where a concern's been brought about, what if I give my mom COVID and it makes her really sick and, it could cause her to die because her immune system is already struggling. So that's definitely something to keep in mind. And then also to note that anger can be a really big thing for this age group because it can be a little bit easier to express than sadness for some children. And in the picture, I have just an example of some activities that, Tory and I might do with children to help them to normalize that expression of those emotions. And oftentimes this anger can stem from those changes in routines. Like, for many, many parents, it's that change in energy level. My mom used to play with me. My dad used to take me to hockey practice, and those things have changed. And at this school age, it's a lot about how does my life change and why is my life impacted because of this cancer as well. But helping children to identify where and how in their bodies they feel these things. And the range and normalizing those things as well. And then when we get into the 9 to 12-year-olds or the older school age, their thinking again starts to evolve. They're able to understand things a little bit more abstractly. I think cancer is a complicated concept for everybody, but this is starting to shift a little bit. They might be able to understand some more about cells and how, the causes of cancer, that can be really complicated for somebody to understand. And this is where that starts to grow. Full understanding of the concept of death. So that there's many different ways that people die and what happens when somebody dies. So oftentimes, I may use the words that your body stops working, and we help kids to understand that when someone's living, that they breathe and they have a heartbeat and they can move and eat. And helping them understand these things. Sleep disturbances can be really common among this age group, and a lot of that can stem from worries as well. Anger and rage, again, this can have a lot to do with the changes in their routine. I know especially right now, I have a lot of families that I work with where the children really want to go to school, but it's just not safe, and families aren't feeling safe with having their kids go to school because a parent's going through active treatment. And that can be so frustrating for a child who wants to see their friends and wants that normalcy to be with their peers who are becoming that really important influence in their life. And as we talk about rage and anger, an activity that I like to do, and it's one that I've included on this slide, is toilet paper targets. So for example, with kids, we create this board that shares the different things that they feel angry about. So whether it be changes due to cancer, or just that cancer has come into their life and has put their loved one in a different position. But also from, my brother annoys me and eats my snacks, and, we have some fun with it and wet toilet paper wads. And it's a healthy way to allow them to express this anger because it's very normal and it's okay. And anger can be that secondary emotion, and that's what children express that. Also, a need for more details and reassurance. So again, you're going to notice that sometimes children of this age will continue to ask questions because sometimes there can be worrying concern that maybe they're not hearing the full truth, or they're hearing all side pieces in adult conversations. And sometimes they just need to know that nothing has changed, and that you have encouraged that you will continue with that honest and open conversation. Sometimes for kids, feeling different is another big thing too. I don't get to go to school, or I don't get to do things because something in my family has changed in my routine. Or even some kids can have some responses related to their loved one's appearance. Some embrace their loved one's hair loss, for example, if they do have hair loss or if there's changes in their appearance. But some kids can have a really difficult time with it. And if there's anything like that that makes them or their family stick out from the norm, that can be a really challenging experience for a child this age group as well. So when we get into the teenage years, again, some of these things can overlap a little bit for sure. But usually their understanding is a lot more mature. There can still be misinformation though, depending on somebody's experiences. And then also thinking about life and the meaning of life. So it's really important that, as parents, really facilitating ongoing dialogue about this, and, being open and allowing your teens to be able to express themselves in lots of different ways. So through media, through journaling or creative arts, and just allowing your teen or child of any age really can benefit from these opportunities of expression. It's also helpful to encourage teens to seek a support outside of their family. So whether that be through, for example, Gilda's Club, Tory and I both offer teen support groups, or having a mental health professional or a guidance counselor at school, because oftentimes, just like young children, teens can often lead to trying to protect their loved one, or might feel some burden over the feelings that they have. I shouldn't feel angry because my mom has cancer and it's affecting my life. And sometimes, they can spell it out, and they might feel bad for feeling that way, but it's human and it's natural to have those feelings, and we have to allow them to have the space to share those things. Or sometimes it's just so hard to talk about, especially if they're topics that can make somebody else feel upset. Talking about death, for example, or the possibility of that, can be very challenging. And if that's something that's brought up, it can make people upset. And sometimes that can be a really uncomfortable thought, and it can really reserve teens from feeling comfortable to have that dialogue. And I think, just in my experience working with teens as well, a big thing can be the lack of understanding from peers and teachers. Can be a really challenging thing as well. Sometimes for them, I've heard them express that, it's hard to focus at school. Or, other kids will complain about things so that seems so mundane, like homework, when they're concerned about their loved one, surviving and getting to see them graduate. That can be a real fear for teens, and also can be super frustrating. Or, when other teens might joke about cancer or other things, and it can be extremely hurtful because they've never had an experience and they can't relate, so they don't take it as seriously. Whereas for a teen who's going through this, that's their life and they've had to learn these things, and it can be a huge disconnect for them. And it can also be challenging for teens to reach out to their friends. I've heard a lot of teens share that sometimes they worry that their friends will feel bad for them, or maybe sometimes friends say things that might not be the most helpful. People often try to fix things when that's not always what somebody who's reaching out is looking for. So those can be some common things that are experienced. And I think also for this teenage group, noticing that, some of that anger and expression of feelings can be directed and projected on family members because that's who they feel comfortable with. And, it's these things that can build up. So it really reassures that importance for those modalities of expression. And also just a final point here is understanding that sometimes at this age group too, there's that growth and independence. So sometimes there can be distance where teens try to spend more time with their friends, which is very developmentally normal. But there can also be, a need to feel close, and that can really differ depending on the teen that we're talking about. So Tory's going to talk a little bit more about having the conversation and some of the considerations around that.
So there's no ideal time to have the conversation. There's never going to be a right time where this is an easy and natural conversation. But I think it's important for parents and caregivers to think about the support that they need themselves in order to have these conversations. And maybe that's support in organizing your thoughts or the exact words on how to help your children and help them understand, but giving yourselves and parents the opportunity to really rehearse and be comfortable with the words that they're sharing and talking about with their children. Because it's a really difficult conversation, and knowing that there might be tears in conversations like this, and that's okay, because that's modeling healthy, natural feelings of life, and you're preparing them because feelings are a part of life. And they'll never be the appropriate time, but I think thinking about when in the day how that's going to look is good. Obviously not before you're going to school, maybe it's not right before bedtime, but thinking about the actual physical time within your day. And then initiating the conversation is a lot around finding out what your child knows and asking them, have you heard anything? Or maybe you've shared with them cancer, but they don't know what exactly that means at that point. So just opening the doors and asking them, have you heard of anything? Or is there anything at this point where they're feeling unwell about or not understanding that you could help clarify? Because quite often kids have overheard conversations, or they're sensing things from the family within the home, and they might already know more than what you think. And I have seen that plenty with families, is older children especially, if they're not knowing the information exactly, like I said, they're feeling the sense that something's off. And having that stress within the home often will show this with kids. So it's important to encourage them to ask questions, what they know, and check in on them frequently. This isn't going to be a one-time conversation. For younger kids, they often and will need repetition, time for them to really process the information, but to go back and repeat what you've told them, and use that through play in the home. Use that through natural conversations throughout the day to really reiterate what you've told them and continue to prepare them for your experience. Or maybe it's an older child and time has passed. You've continued your treatment, but things have changed. And now developmentally, they're at a different point where they were 2 years ago. So they might have questions now. So really continuing that conversation throughout a span. And as Jocelyn said earlier, using simple and honest, concrete information and breaking it down. You don't need to share everything with them, right? You can have the conversation and share with them what you know. This is what you know right now. Some kids need a lot of information and some kids need this much information, and it might look different if you have multiple children. And maybe one child needs every detail of what's going on in your treatment and what that looks like and what that feels like and how can I be there. And maybe one child just needs a summary of this is what I'm doing right now and this is what is going to happen, and a shorter span of that. But really using that concrete, simple language, especially to clarify the concepts around the 4 C's. The next slide there, Jocelyn, and we'll skip over. So the 4 C's. When anything big happens in a child's life, something significant, such as a divorce, a sudden move, when a parent's diagnosed with cancer, a death, there's often 4 things that kids have many common fears, worries, and anxiety over. And it's these 4 concepts that really get down to the specifics of how we need to clarify their understanding and support them around these. And it's, can I catch it? Can I cure it? Who's going to take care of me? And did I cause it? The younger kids are, the more likely it is where they're impacted by those misconceptions. But kids are really egocentric, and we really need to clarify these things with concrete information. The more concrete we can be, the better their understanding is. And there's really multiple points throughout their development where these 4 C's could be in the back of their mind, causing their worries and causing their anxiety. COVID, sickness, cancer, can I catch it? Did I cause it? The sense of guilt for those school agers. Did I do something to make this happen? Or can I cure it? Can I do something to make this better? And who's going to take care of me is a significant one. Mom, dad is going to the hospital, but who's taking me to soccer? Because that's a priority. Or who's going to be here if mom did die from cancer? The next slide there, Jocelyn. Thanks. So at Gilda's Club, when we're working with kids in our groups and at home, these are some different examples of how we define cancer and really build on children's understanding of these concepts. So we know we want to start small. This is what I have. This is what it's called. That's a great start. I have breast cancer. But breaking it down and putting it into compartments where you can provide simple, concrete words, calling it what it is. But it's important to be careful with your language, because maybe it means talking about something such as a treatment for surgery. And you say, well, I'm going to get cut and they're going to take the cancer out. Well, cut can be a really scary word for a young child. So using words like they're going to make an opening and remove the bad cells. Kids can be really literal. And so using that really concise language is important. And some kids, again, need a lot of information, and other kids just need little bits and pieces. But take the lead of your child. And this could be different for each of them. And we do this a lot because play is natural to kids. Play is how kids figure out the world. And they learn to master skills through play. So we use play to play it out and build their understanding. We have a few pictures there, and one of them is of the cutout, and it has some stickers and it has some clay. And on this evening in our group, we were talking about specifically what is cancer and what does that mean. And here we're just showing an example of the cells, and we use different colors of dots to represent healthy cells versus cancer cells, and then used a third color representing the treatments. And we talked about the treatment. And we used clay to make those cells and what they would look like under a big magnifying glass. And then at the top, I'm not sure if you can all see it, it's fairly small for me, but I think it's a picture of cancer soup, where we've used different candies to represent the different cells of the body, put them in a bag of syrup. It's good because it's clear and it's the plasma of the body. And we use the candies to represent healthy cells, white cells, red cells, and cancer cells. I often use like a gummy worm to represent a weird and abstract cell compared to the red cells. And just giving this opportunity to allow for fun and play to open the conversation and define what cancer is. And while we're defining it, we can really identify what the next steps might be for parents in their treatment. So maybe it's an upcoming surgery and you're using these play opportunities to initiate the conversation. And of course, it's important to always be honest. We always want to answer as most honest as possible. And you might not have the answers. A lot of the time, it's complicated, there's weights, it's a waiting game, and it's exhausting, not knowing the answers and what's to come. And we just might not know the answers. But I think it's important to allow kids the space to ask the questions and then let them know if you don't have the answer, but reassure them you're gonna find out the answer or provide them with more information to answer their questions. And if there isn't an answer, like why do we get cancer? It's okay to wonder with them, because there's a lot of things in life where we just don't have the answers for, and talk about that openly.
So kind of building off of what Tory's saying, validating those questions that kids are asking. Sometimes kids need to feel like they have permission to ask these questions, because possibly talking about cancer, they've seen you be upset when you've talked about it or have tears, and assuring children that sometimes that the questions that they ask might make you feel sad, and that's okay. It's not anything to put blame on you. Sometimes it's just something that's really hard to talk about, but validating that these are good questions, and saying that's a really interesting question, that's something I wonder about too, or I think that that's something that we could find out together, and just really opening the door, because sometimes our reactions are going to either open or close that door of communication for kids. So we want to make them feel comfortable. And I'll explain on the next slide too, a neat intervention that you can use with children as well, if, possibly you're put on the spot or you're concerned that you don't know how to answer it, or, if just always facilitating that ongoing communication as well. Being aware that kids might ask about death and dying. So we mentioned this a little bit earlier, but that's something that, again, can be common, especially depending on what their previous understanding was. And that's also something to understand where your child is at. Maybe when you go to the hospital, they've actually never been to the hospital before, or maybe their only experience of someone being in the hospital is the last time they were there, or last time somebody that they knew went there, they didn't come home because they may have died. So that's something to try to think about, what has been their experience with death and dying as well, and knowing how to nurture that conversation. Reassuring children that you'll be honest and provide information as things change. So taking things in chunks is important, and being able to assure kids that, right now, this is the plan. And, it's okay to say, I know some people do die with cancer, but right now the doctors are doing everything that they can. And this is why I'm having these treatments to help take away as much of the cancer out of my body as they can. And this is something that we're hoping will work, and it sounds like it's doing its job right now. But if that changes, we'll talk about it. And it's also just important to stick to your word about that too, because as things change, or if children have questions that they ask other family members, that could be an avenue where possibly they get information that's different from somebody else. And I think in terms of our reassurance with children is knowing that as their understanding starts to grow, they might ask other people questions too, and that gives them a well-rounded understanding. And that's, you know, sometimes that's a part of that reinforcement from them, is seeing what answers they get from other people as well. And something to also think about with, I think, our older kids and teens who are very tech savvy is that they also, in addition to picking up on side conversations or seeing pamphlets or, you know, picking up on those cues in the environment, they also have technology at their hands. And that can be really scary, even as an adult, to read some of the things that they might find online. So I think it's really important too that, you know, for parents to, if you're comfortable, to really keep that door open to make sure that you can do the research together and make sure that your child's getting information from credible sources, or, you know, possibly it's something that you talk to your team about, because every cancer and every person's experience with cancer can be very different. It doesn't mean that because Google says that my mom has this type of cancer, that it's always going to be the same. Checking in, like Tory said as well, kids and teens need time to process things. And sometimes at different developmental stages that changes, or as new things progress as well. And the Be Right Back jar is a really neat idea. And it's something that, you know, a fun way that you can facilitate this communication with your kids. So say, you know, right before school or right before dinner, and maybe you're in the middle of something and can't dedicate the time that you would have liked to be able to address their question and talk about them with it through with you. You can have them write down their question, or if they have troubles with writing, it's something that maybe you could write down and put in the jar, and it's something that you can revisit on your own time if you need to do some more research, and then go back to it with them. So it provides that opportunity to validate the question that a child's asking, but also to give you that space if you need to process the question yourself, or get some more information, or possibly just finding a better time that allows for you to fully explore that with your child as well. So Tory is going to talk a little bit about grief.
So what is grief? Well, we know grief is all the feelings we have when something really difficult happens in life. And when dealing with the hard stuff in life and the suffering, a lot of people are really uncomfortable with it. We live in a society where we're told to put the brave face on, and we wear a brave face naturally because it gives us this need to be strong and to contain ourselves. The okay face, or when someone asks us, how are we? We automatically say, well, thanks, how are you? And this means I'm strong. And sometimes if we don't talk about it, it might not be true, the really difficult things we're experiencing. But we want to be open and talk about the really hard things. And in my work, I'm really passionate about supporting kids in their social emotional development. And I feel personally that children are going to learn how to read and how to write. But the really significant piece of their development that they could use support around these days, and at this time, I feel, is the social emotional piece of their development. And really helping kids identify the feelings they're experiencing. And the best way we can do this is to model our own and lead by example, and not to minimize our feelings. We label them and we can validate them, whether it's ourselves as adults or for children, because a lot of young children really need the support in helping them understand, what is this crazy feeling I'm feeling? I'm feeling really frustrated, and I don't know what that means and why I'm feeling frustrated. So giving them the opportunity to identify specifically and name those feelings is important. But we also want to reassure them that all these feelings are normal and healthy, and teaching them that it's a natural part of life and adults have these feelings too, and that it's okay. Especially with teenagers, it's important to, again, cultivate that understanding where they can experience really difficult feelings, but still come back out of it and be okay. Younger kids do this well with the puddle jumping, but as you get older with school age and teenagers, just like adults do, it can be more difficult to come out of that and hold space for it. So regardless of the child, even though this really big thing is happening, it's okay to have these feelings, and letting kids know too, we can still experience joy and happiness in our life, even though we have this difficult thing going on. There's no wrong feelings or thoughts, and that we don't actually have to be strong all the time. It's okay. And how we can help kids in coping with or managing these feelings and emotions, providing them coping tools and techniques. And that's through either verbal or emotional responses we have, but really giving them the tools to appropriately express themselves. Often too, it's great to promote their problem solving and strategies. Giving kids a sense of control gives them the ability to master their experience. And maybe for a preschooler, it's giving them the control of choosing what pants they get to wear to school that day. Or maybe for a teenager, it's giving them the autonomy to build their relationships, because we know that they often struggle with wanting to support their peers, but also being present for their family and caregiver and their person that they love so much, but just really finding that balance in their relationships. The next slide there, Jocelyn, please. So developing the emotional intelligence. Like I said, we want children to feel comfortable in talking about their feelings, but really giving them the ability to express themselves in a healthy way. So I have a photo here of a woman on a bus, and she doesn't look very happy. And I just think about how we can incorporate these conversations and provide the environment for our kids to really be able to identify feelings in this part of life with our everyday living. And maybe it's you see someone on the bus that's looking really upset, and you get off the bus that day with your child and you say, you know, that man was really yelling on the bus. He seemed really angry, and I wonder why he was having such a hard day. And just giving that opportunity to talk about the emotions and feelings that everyone experiences in life. I think it's important for kids to know that all feelings are okay, but the behaviors are not. It's okay to feel really angry today, but it's not okay to be hitting and pushing your brother, obviously, and giving them ways to release those anger. Often with young children, I think it's really important to give them the physical tools to be able to calm their body down. Calm down spots, one person corners are a beautiful thing within a school setting, but as well within the home. We all need our space and our own time, but kids, again, they need that concrete example of how it can help me make my body feel better right now. So giving them a little basket of different tools to help them physically regulate their bodies and emotion is a great technique. And just really giving them ways to release that anger. You know, Jocelyn had talked about the toilet paper throwing against the target. It's that physical expression, but also the emotional intelligence piece.
Absolutely. And at Gilda's Club Simcoe Muskoka, we have these little guys called Darn It Dudes. And I didn't include a picture, but that's another great example. It's a little tool that kids can use if they struggle with, say you have a child that will use their body to hit or hurt others or themselves when they're feeling really angry. And although we want to encourage them to use other coping strategies, what we'll do with the Darn It Dude is have them, there's a cute little saying that goes with it, and it has them slam it against a surface to try to whack the stuffing out. And it can be a tool that's used that doesn't hurt themselves, hurt anybody else, or damage anybody's property, but it still validates that need to get out that feeling. And when we talk about ways to help children as well. You know, it really, Tory, I think, has covered so many of these. Sticking to the rules is so important with our kids, and maintaining those routines as much as possible, whether it be having the same bedtime or having a consistent person that can take them to school, or, you know, say there's chores that they do at home. Keeping those in line help children to feel safe and to keep those boundaries, and providing opportunities you know, for children to connect with others, whether that be through a support group or through other people who get it, or connecting with other loved ones as well. And connecting with the school is really important because we know that children will exhibit these behaviors. And if we can have other adults on board that know what's going on and that can help support that child, then that can help them better understand the behavior. And, you know, possibly there's strategies that are being used at home or at school, and to keep that consistency for children, especially in a time where there might be some challenges with keeping that consistency. And being able to check in with kids. I think we've really conveyed this at many points in our presentation, but giving children time, over time, keep asking if they have questions, so that, again, renews that permission. And also being sure to reassure that you'll always be there to share that information. And these are just some do's and don'ts, and I'm not going to go through all of them. You know, it's really, I think, a highlight of a lot of the things that we've spoken about today in our presentation. But it's a nice summary, you know, following your child's lead. I think, as Tory mentioned too, you know, we have some kids that lots of information is helpful, and some kids that can be actually distressing. So knowing where your child's at, and you know what, sometimes a child will go play immediately after you share something really big with them. And that doesn't mean that they're not interested, but just knowing that if that's their cue, that, you know, maybe that conversation is too much right now, or they've kind of heard what they needed to take from that, and then revisiting at a time that, you know, they initiate, or that seems to be a better fit. So this is definitely a list that you can revisit after. And, you know, just some of those things that we know is that calling cancer what it is, children need that honest information. And that's something, you know, to keep as a promise, that you'll continue to be honest with them. It's okay not to have the answer, supporting those emotions, like Tory said, labeling, validating, and not to minimize your child's feelings either. Make sure that, you know, they know that it's okay to experience those things as a human being, reinforcing those 4 C's, and also checking in often as well. So just as a final note, before we get into some opportunities for some questions, Tory and I just wanted to take the time to just give you a brief overview of Gilda's Club. I represent the Simcoe Muskoka Gilda's Club, which is located in Barrie, and Tory is located in Toronto. And at both locations, we serve families who are impacted by cancer, and we have programs that support all individuals, because we know that cancer is a diagnosis that affects everybody in the family. So we have a variety of different supports for adults and children, including support groups, education-based sessions. So for example, that might be something like nutrition during cancer treatment, or coping with stress. We also do these things for children. Tory and I have done educational workshops with kids about worries, and what are some common worries, and how can we deal with our worries. We've had activities where we create worry eaters as well, a tool that kids can use to help tame that and label those feelings as well. We have camp programs on school breaks, some recreational opportunities as well. And all of these opportunities allow individuals to connect with others who understand and who get it. And it's all free support, and our support is professionally facilitated by mental health professionals. So there's a lot to gain from being a part of Gilda's Club. And we're happy to answer any more specific questions about that. But that's something I think, regardless of who you are, where you come from, you know, possibly this is a resource that might be helpful for yourself or for somebody that you know. And we've also shared some resources at the end of this PowerPoint, and I'm not going to go through it for time's sake, but we have several children's books, and there's also a resource guide that's been provided for everybody that's been in attendance, and we have some web resources as well. These all have education and different ways that you might word and talk to children about cancer to kind of complement everything that we've talked about today. And then there's also some information about some of the unique programs that we offer at both of our locations. And depending on questions, we can go into more detail about them. But for time's sake, I think we'll just highlight these and make point that there is more information on them in here as well. So thank you so much. And I know Katie was helping to keep track of some of the questions as well. Yeah. So I guess this is the floor.
Thank you so much, both of you. I know I continue to learn a lot from both of you about how to support kids. And we haven't had too many questions, so if people want to get their questions in now, I think that's a great opportunity. I do want to mention that Jocelyn and Tory have been working really, really hard to continue support virtually and have had a lot of success of kids joining support groups. They also do individuals. So I know Jocelyn does individual work with kids, and Tory does a program called Empowering Parents. So actually having and sitting down with parents to empower them to have these conversations and feel confident in what they're telling their children. So at the end of this, I'm going to send the presentation and the slides and the resources, and as well as their contact information, so you can get directly into contact with them. So someone's asking, are you able to please post the page with the resources one more time? So we're going to send you a beautiful, wonderful little write-up with all of the resources in it. So not to worry about that. And I did want to mention one question that somebody had asked prior to the program starting. So they asked, I've been going through treatments for about 6 months now. How do I keep the conversation going with my kids to check to make sure they're doing okay? My kids want to protect me.
I think that's a real common question, especially for older school-age children. That instinct of wanting to, like you said, protect them and not burden their family. So again, just reiterating that you can provide these natural moments to discuss hard things, difficult conversations that you think your child might be thinking about in natural ways in your home. It doesn't have to be, I'm going to sit down and talk about my cancer diagnosis, but maybe it's, I'm checking in with you. I know we've had a few hard months. How are you feeling about my illness? Or reiterating to them one day, you know, last week I was feeling really stressed because the doctor had shared information with you and maybe I wasn't so fair with you. And I'd like to share some more information with you now. But again, just giving them that space to feel and experience and express their emotions and validating those in a natural way throughout their schedule and daily lives.
And I would also say, to build on that too, is like also, you know, seeking out opportunities where they can have that space with another group of people as well, like having, maybe there's a trusted teacher at school or another adult in their life. And I also find that, you know, the kids and teens that are involved in support groups, you know, they might be inclined to share how they're doing or share some of those feelings that they try to protect their loved one from. And, you know, maybe that's that first initial stage where they might express those things and they're not yet ready to talk to their parents. But I know, like in our support groups that we offer, you know, it's something that we talk about, you know, what are you hesitant about talking to these things with your parents about? And how can we encourage you to feel comfortable to say, you know what, these are things that I've been thinking about, and, you know, helping them to gain that confidence to have those conversations with their parents too.
Thank you. So I know it's 8 o'clock, and so people might be signing off, but we're going to stay on a bit longer just to answer these 4 questions that have come in. And we will be sending the recording. So if you need to go and eat your dinner, you can check out the recording after. So someone's asking, they said, amazing presentation. Is it okay to teach kids to punch things to get their anger out?
And I think that's a really great question. And I like to address that because I've heard lots of different responses. And I think that I always have a couple of rules when I talk to parents and children about facilitating healthy expression of anger. Is it something that hurts you or somebody else? And that could be physically or emotionally. And is it something that damages somebody's property? And I think that those are some key things. I would absolutely recommend, you know, any kind of expressive modality like, you know, arts, or getting, for a lot of kids, the anger, getting that out physically through sports or through other things like that can be a great way to channel that. But I would say if you have a child who is hitting or is exhibiting some of those behaviors, sometimes something transitional, like punching a pillow or having a darn it dude or something like that, can be the transition that some children need. It depends on the child that we're talking about, though. There's some children that, like, I know if you were to talk about me as a child, I wouldn't have felt the need to get physical anger out that way. That wasn't how I experienced it. But seeing some children do, and that is their first instinct of how they feel it in their bodies. And, you know, it's a process. It's something that, you know, gradually helping kids understand, okay, let's notice how your anger is building. Where do you feel that in your body? Do you notice your muscles getting tight? And helping them learn how to regulate that and to take a break and to be proactive in their anger. So I think that there's a couple of different ways you can approach it.
Someone's asking, can you provide a script or general guideline to follow when telling a child someone has died? And just before I hand it over to you, I'd like to just say that in March, we'll be offering how to talk to your children about grief, a session. So that will be coming up. So we will go over this in a little bit more detail. So maybe you could do a quick summary.
Again, I think it's important to really inquire about what their current understanding is. Some kids need different answers depending on their development and what they know and what information they've been given previously. But a general description is, I think Jocelyn had mentioned it briefly earlier, is really reiterating the physical aspect of death, and that when you die, your body stops working. And it's important to add, it'll never work again, because children who are younger can really have that misunderstanding. They don't have developmentally the concept of the finality of death. And we use language quite often naturally as, we lost grandma last week, or they've passed on. Well, what does it mean to pass on? And a lot of older kids will wonder about that. What happens when I die? And again, going back to leaving the space to wonder, we don't have the answers and we don't know what happens when we die, and giving that space to inquire, but physically reiterating that the body has stopped working and it'll never work again. And going through that, you don't hear, you don't feel, you don't smell, and you do not experience pain anymore is really important.
And I think to build on what Tory's saying as well, you know, like I said, like sometimes like having kids notice, like, can you feel your pulse and your heart beating and your breathing, and also giving examples in their life. Like maybe they've had a pet die, or maybe they've seen a dead animal on the street, and using those daily examples even before a child experiences a death, and normalizing that even before it has to come into conversation, because that's a part of the life cycle and it can be hard to talk about. And it's okay if a child might be upset. You know, there is a concern, you know, I don't want to ruin my child's innocence, but that's a part of it, is acknowledging that is really sad, but that is what happens. And this is what happens when someone dies. And there's lots of really good books and other resources too, to help reinforce that information, because like anything, whether it be related to death or grief or cancer, kids need that reinforcement in different ways, whether it be through our words, through books, through real life examples. So there's so many different ways to do that. And I think a big thing, though, I would also add to the languaging, like Tory is saying, is to refrain from using a deep sleep or anything like that, because children can often have difficulty going to sleep at night, or have nightmares, or even worry about their loved one or themselves, worrying that, well, I go to sleep every night. What if I don't wake up? So just differentiating, like Tory said, the sensory experience, that they don't experience those things and it's not like a sleep, because oftentimes I've heard adults use that, and just be cautious of that and those dual meanings.
And I think my favorite thing, even for adults, is talking about death is not going to make it happen. So even when we have these conversations, we're preparing, you know, all of ourselves that this is the life cycle. It's a natural part of our existence. So someone asked the question, how did you get into child life? But I let them know that I'll give them your emails and that they can contact you directly, and you'd be happy to respond to that question.
They're long journeys and they're exciting to talk about, but I feel like you could do a whole nother presentation.
So the last question we'll ask before we end this evening is, do you link to the teachers at school to support children in their grief?
I answer that one first off, because I'm really excited about this resource and I try and share it as widely as possible. So the Children and Youth Grief Network are an umbrella of organizations in Toronto and GTA, and they support grieving children. And this organization, Children Youth Grief Network, has an extensive amount of resources that they've developed and put together to advocate for the needs of grieving kids. And one of their most recent resources is called the Grief and Death Education Toolkit. And it is a toolkit designed to support educators and school support staff in integrating the conversation of death and dying into Ontario's current curriculum, starting at grade 4. They also have several tip sheets for educators to download and share. They have a video of how to, it's called, Weathering the Storm, Parenting Grieving Children. And it's a free e-learning toolkit, course, online course that parents can take at their leisure and really gain some more insight into how to support their kids. But definitely educators should be sharing that with any families they feel might need more support. Sorry, Jocelyn.
Oh no, I think that's a great highlight. Absolutely. And I would just say, like, depending on where you live, there's different resources. Like in Barrie, where I am, we have a place called Season Center for Grieving Children. And although I'm always happy to be, you know, a connection to the schools and to be an advocate for children and to talk and support and give those resources like Tory's talking about, we like knowing what's in your community, because in Ontario, we are fortunate to have very similar supports. Like we know in certain areas in the GTA, like we have Dr. J's, or we have Lighthouse Center for Grieving Children as well. And some of those supports can also be very beneficial for educators. I know Seasons locally for me is an organization that will actually do some programs in the schools for kids. So it just seeing what's out there and knowing that, you know, we're always happy to support in what we can, but there's also some organizations that do some of that work as well.
I want to thank you both. There's been a lot of thank yous coming in saying that this has been a great presentation. And to finish this presentation, so we'll be sending the PowerPoint, the resources, and Jocelyn and Tory's contact information. As you can see, they're a wealth of knowledge. They're also really knowledgeable of what's in the community. So if you're out looking for specific resources, I know they'd be happy to help. We'll be offering our kids programming continuously, so check our individual websites, or if you just want to ask us directly, we'd be happy to do that too. At the end of this presentation, a survey will pop up. If you could answer that, that'd be fantastic. It really helps, your feedback helps us to pick education topics, to learn how we can do a little bit better, especially if there's specific things you want to know about talking, more just about talking to your kids, maybe coping activities, things that you could do in your home, things that you could maybe put into your practice. I know we'd be open to doing that as well. So we thank you for being with us, and we'll see you hopefully soon in the new year.
Thanks, everybody.
Thanks, guys.
Thank you, everyone.